actually have some common questions that newly diagnosed cancer patients can discuss with their medical team. So let's go through one of these one by one. Let's look at the graph. Will my treatment affect my ability to have children in the future? Like we said, that's a very common one.
Correct, yes. And oftentimes, right, it completely depends on the plan of care as created by the oncologist. As I said, there's no real way to measure or to definitively say that one cancer treatment will definitely affect fertility forever or not. But again, we counsel all patients in the same way, notifying them that they may have a risk and that they should pursue fertility sparing measures.
Dr. Diaz, how steps before beginning treatment? Once the patient has decided to preserve fertility, what are the steps?
Yeah, I think this is a very important question. And again, it really depends on the tailored treatment the patient's going to receive, right? And so depending on whether this is surgery, chemotherapy, radiation, and to what part of the body are the options in that we can work with our colleagues in reproductive and infertility as far as developing a plan. Sometimes it can be simply trying to suppress the gonads during the treatment. Sometimes we need something more invasive as far as trying to harvest either sperm banking or oocyte or embryo banking. So it's really tailored to the individual patient and tailored depending on their specific treatment for their cancer. And this is why it's so important for these patients to be seen in a large center such as ourselves at the Miami Cancer Institute, where you have a whole team that's devoted to this. And we have ourselves, social workers, our nurses, our colleagues in infertility, all working with the same common goal for these patients.
At the Miami Cancer Institute, what are some of the options available? A patient wants to have children in the future, and they want to ask you if that treatment affects them getting pregnant.
Yeah, so again, that's one of the conversations that we have with our patients who desire future fertility or who just aren't sure and want to know what the options are. And again, we work in a collaborative team between the various groups to really tailor not only the treatment, but their either pre or post-treatment fertility options.